Hi, I'm Dr. Steve Greene from Advanced Dermatology and Laser Institute of Seattle. Here in our practice, we have a special interest in the treatment of scars. We see all kinds of scars in our practice. And for treatment of keloids on the ears due to piercings, one of the best treatments for this is the use of a technique called Cryoshape. Some of our patients will get piercings just in the earlobe or multiple piercings in the earlobe, like so. Also up the pin of the ear, patients sometimes will develop or will put in place earrings and piercings, but more commonly, we're seeing patients who are having piercing through multiple zones of the ear, and they're developing keloids in this area and this area as well. And then, of course, patients can get the keloid formed on the anterior part, and then in the posterior area of the earlobe as well. So Cryoshape is a treatment for keloids that's very effective. And how it works is we put this hollow probe into the keloid, and after penetrating through the keloid completely, we then connect this hollow tube to a tank of liquid nitrogen. And we then will start the flow of liquid nitrogen through the keloid until we create a frostbite phenomena of the keloid. We're actually killing the cells that make up the keloid. And within 3 to 6 weeks, the keloid actually falls off the skin surface and usually does not come back. So today we're doing a Cryoshape procedure for a long-standing keloid in this very nice patient's keloid on the left ear. There had been a previous puncture to the ear where she had had her ears pierced. And how many years ago was that? 5 years ago. So this slowly grew into the keloid that we see today on exam. We've just provided local anesthesia to the keloid, and the patient has told us that she does not feel any sensation in the areas that we've just numbed up. So we're going to now place our Cryoshape probe where it needs to be.
Doing okay?
Yeah, I don't know why.
It's just the pressure that feels weird, yeah. It's normal to be a little squirmy. Perfect.
Perfect placement.
Okay,
Alrighty.
hardest part's over.
Yeah, congratulations. Let's bring the garbage can. I want to have it right at her feet so that we can just drop it in there. We'll put over there.
Underneath this side.
Perfect,
A little
perfect.
bit. We're good on that side.
Good. Alrighty. Okay, now we're going to hook up our liquid nitrogen tank to our Cryoshape probe that's in the perfect position, sort of at the base of the keloid itself. Very nice.
It's 10:18.
10:18. I
Ready?
like that number. We'll start.
Go.
So today we're going to do something that is especially helpful. We're going to be putting a specialized clamp on the keloid to cause the freeze to be even greater. And we have found that patients are having an even better freeze when we do this. And we have this perfect clamp that we have found, and we use it, and really causes a greater kind of tightening of the keloid around the cold probe. the Cryoshape probe, and I can already see that it's starting to freeze at the ends.
It's been 5 minutes, so.
Wow, okay.
I wonder how different it's going to be than my other one.
Yeah, well, time will tell. I'm very anxious to see. Your other,
I feel really good about it.
Your other keloid treatment with Cryoshape was awesome and very good. And this is actually a larger keloid than the other one was. I'm very hopeful. We can see now the rim is enlarging of our freeze, which is really awesome, really great. You don't mind that we're talking and
No, this is great.
giving you updates and so on.
You're
We're,
making me comfortable.
oh, good.
Yeah, the silence would be a little
I
awkward.
find that, if we can talk about this, we purposely insulate the areas around the Cryoshape probe because we only want to freeze the keloid. We're not interested in freezing other parts of, your neck or behind the ear. So we have extra layers of gauze around. The tip of the Cryoshape is actually very pointy, and it's protected, from your skin on purpose. We do this for your comfort and safety. Well, your keloid is getting colder and colder and colder.
Yep.
We're seeing your keloid actually march along with the cold. There's like a wave of freeze. We're trying to develop nothing short of an iceberg on your earlobe, actually causing the whole keloid to become white and frosty, and that's what is happening. I would say at least 50% of your ear keloid has already frozen solid, and we're just waiting for the rest, and it seems that it's moving along very nicely. You're coping very well with today's treatment.
Definitely feels heavy. I can tell that it's solid.
Yeah.
Do you feel anything really cold? Are you feeling okay?
It's just cold. I feel the residual heat, not the cold.
Okay.
not the actual
Okay.
cold.
Yeah. So
Your skin's pretty well protected.
yeah,
I just
you're-
always like
you're
to
doing
check.
really good, and I want to just keep going until we get maximum
Yeah,
freeze.
it's going quickly.
Yeah. I would discourage people from piercing only because of the unknown. However, because it is unknown, I think as much knowledge and control before doing a piercing is in order. I would recommend, just in terms of protocol, anyone who's considering piercing their ears or other parts of their body should try to ask family members if there are any family tendencies for keloid formation, and that could represent some early warning information. I also would like to say that and because we see patients who come to see us with post-operative keloids, we've had patients who have had breast surgery, abdominal surgeries. I would encourage surgeons and physicians who are part of the planning of more, big surgeries to include in their history taking, is my patient prone to scar formation or keloid formation? I think that that's really a great service to patients. We have had patients who went for elective surgeries, like breast augmentation, just as an example, and they ended up with more than 50 keloids around their breasts, post-op, which is unfortunate. So those questions should always be, asked, and if a patient knows that they're prone for scar formation, that should be, volunteered to the doctor. Don't even wait for the question. It's important that the patient should, feel comfortable bringing that up in the pre-surgical evaluation. So we're almost done. We have just just a little sliver of tissue remaining. I can't tell you how exciting this is. This is one of the best cases we've ever seen in this clinic in terms of the keloid freeze. And even this last sliver is now freezing very nicely. This is really remarkable. Yeah, I think it's really important that we get the word out, to the public, about potential risks, for anything. But as it relates to scar tendencies, this is an under-recognized area that I think we could do a better job, for public health.
Yeah.
That's what we're talking about, public health here.